So again, this is Ross Bindler, and I'm here to talk to you guys about the Micromedex system. So the Micromedex system, you access it the same exact way from this resources page, except you go down to the Micromedex one, give that a click. It'll bring it up with some login information. So after you guys get logged in, passwords and stuff should be provided to you. You just go to the Micromedex. This system is widely used in a lot of hospitals and health systems. It targets nurses, pharmacists, physicians, ED departments, students such as yourselves, and drug information and poison center specialists, because it's evidence-based primarily. Also, it has better IV compatibility, drug identification, drug interactions, drug comparisons. Also has a neofax, which you guys will probably get later in notes, and a care notes section. The neofax just is out of the realm of this discussion here today. But while clinical pharm is pretty much just going to be a thing that's used a lot in the community, this is going to be a thing that's used quite a lot in the hospital setting. So I wanted to show you guys how to use the download center real quick, because they do have apps and everyone wants apps on their phones. So they have a Micromedex reference app, they have a drug interaction app, and they have an IV compatibility app, which could come in very useful during some of your institutional and acute rotations. You may end up using them. But these passwords that they give you for it, here, they only last 1 year. So every year they expire, and it was about May-ish this year that they expired. So one day you may log in and not have one, but just go to the download center, which is up in the corner, and you'll be able to get back. So from the main page here, you can find information on a drug or disease state. You can read some of the latest news, access specific resources, and access help using the database. Most frequently, you'll just be searching for something. So let's do the same one that we did before. So atorvastatin, generic Lipitor. So this is just a brief summary of Lipitor. You'll have this link up here that in-depth answers. It gets a lot bigger and more complicated when you get there. One thing that's really nice about Micromedex is it's cited throughout, so you can pull the citation if you need to be. So let's say we're down here reading about drug interactions, if I can find them. Let's look at kinetics. So now we're in the detailed of the pharmacokinetics, and let's say I want to know what the Cmax of atorvastatin is. So number one, oral peak concentration in 1 to 2 hours. So, but man, where did they get that information? You can click, it gives you it. So they got it from the labeling. What's 298? this is a study that we could find if we wanted to. So the effect of age and gender on the pharmacokinetics of atorvastatin in humans. So let's see. Let's go to some PubMed. See if we can find this article. While we're waiting, the Cmax of atorvastatin in healthy volunteers range from 12.7 to 27.1 nanograms per mil and 13 to 25.2 after single and multiple doses of the 40 milligram dosage form. So there we go there. Let's see if we can get this kinetic paper. And how did they get that? So in this paper entitled Pharmacokinetics of atorvastatin and its metabolites after single and multiple dosing in hypercholesterolemic hemodialysis patients. So here it is. Great. I can go back and I can back check the information that they have. That's one of the really good things about this this database. This database does a lot more besides that. Let's look at drug interactions. And before we were having a hard time because clinical pharmacology didn't tell us there's a drug interaction when we were giving them duplicate therapy. So let's see if this one will find that for us. So some atorvastatin calcium, and then let's do the Vytorin again. So drug-drug interactions weren't found. Ingredient duplication, not found because it wasn't atorvastatin. Then there's some drug-food interactions here, drug pregnancy interactions, drug lactation interactions. So again, it's really difficult for these systems to pick up on duplication. It's a very difficult concept, so you're going to have to try to find a way that works for you to recognize this. So we get to the IV compatibility. This one is done by Trissels. Trissels is a book that does multiple copies every couple of years. He's very smart, and there's this guide and one other guide called the King Guide, and we'll get to that in a little bit. But this is so if you're putting two solutions together to give intravenously, you need to know that they can combine or be given together. So if you have insulin, let's just say we're getting some regular human insulin, but then you're also getting some potassium chloride. Yep, they're compatible. So how about, well, since they're compatible, let's add a little something else as well. Say the last time you did it, you got kind of nervous, so this time they're just going to give you a tiny dose of Ativan to go with it. So is that all still compatible with one another? Yep, all compatible. And then you can check it, the admixture, if they're compatible, not tested, and then in syringe, they haven't been tested. And so this is a good situation where I would highly recommend that people use both Trissels and King's Guide, and we'll go into King's Guide in the next database. But you want to give two if you're unsure, if they have a not tested or they have one of these question marks. It's best to know for sure rather than not guessing. Maybe one has found a different paper somewhere back that had it in it. This also has a good drug ID form. So for drug ID, let's do that same imprint. Remember, it was only had an imprint of 313. So let's search that. Ooh, there we go. See what I mean when sometimes you just add too much information? When you cut it down, you get exactly what you want. And there we go, the Vytorin 1040. Let's go back home. So it has the red book, it has toxicology, which is really, really useful. And it also has clinical calculators, which can be useful too. Let's do a drug interaction check, another one, where we'll go over a little bit more information for you guys. So we will have some Vytorin and some lisinopril and some Norco. And since he was on atorvastatin, let's throw that in there too. See if we get any reactions. Alright, so drug ingredient duplication. This one catches the acetaminophen because it is the same product. As we saw earlier, it didn't catch it when it was when it was simvastatin and atorvastatin, it didn't catch it that time. But now we know that duplication of Tylenol. Drug-food interactions, we won't worry about those right now. Drug ethanol interactions, drug lab interactions, drug tobacco interactions, drug pregnancy, drug lactation. So there were no drug interactions, but when we look at the drug food, obviously the hydrocodone with acetaminophen has a major one with grapefruit juice, as any drug that goes through the CYP system in the liver grapefruit juice messes with all those enzymes. So it's going to be the same with the simvastatin and same with the atorvastatin as well. And then there's minor ones here of food may decrease the peak of acetaminophen, which is a very minor one. But then you have your drug ethanol. For the acetaminophen, you get the excess liver toxicity. And then not only with the hydrocodone do you get the excess liver toxicity because it is in combination with acetaminophen, you also get the excess of taking a sedating narcotic with alcohol, and that can lead to many, many, many more problems that are out of the realm of this, but just as important as anything you'll learn. So I would recommend doing some of the tutorials, some of the trainings. You'll get better at it, and you'll learn where everything is, how to access everything, and how to get the information out of it that you want. This is one of my favorite databases. I like a couple other ones, though, a little bit more that we won't be going over, but you'll have plenty of other time to figure out which databases you like the best later on, as you're just getting started right now. So we'll have one last video and then you'll be done.